Hi, my name is McKenna and I'm going to be your student nurse today. I'm going to be performing a head to toe assessment on you. For starting off, I see that you are well groomed, there's no obvious sign of deformities and you're not using any medical devices. And assessing physiological distress, there's no labored breathing, no diaphoresis, no vomiting, no expressions of pain, and no seizure activity, and no bleeding. Will you please state your name, the date, and where you are?
Merritt Bether, it's April 24th, and I'm in Fayetteville, Arkansas.
Your speech is clear and articulate, and you are being cooperative. And I'm now going to assess your head. So, I'm just gonna feel. Do you have any scalp tenderness?
No.
So there is no scalp tenderness. Her head is normocephalic. There is no trauma present, and her hair is evenly distributed. I'm now going to look at your eyes. Will you please follow my pen with just your eyes? Perfect. And now will you look straight ahead, please? I'm going to shine a light in your eyes. Great. Okay, perfect. I see that she is able to follow in all 6 directions, and her pupils are equal round and reactive to light, which means that cranial nerves 3, 4, and 6 are intact. And I see that the nose is symmetric for the face. It is on the midline, and I'm going to have you blow out of each nostril. Nostrils are patent. And now I am going to have you open your jaw for me, close it. Do you have any tenderness in your joint? So there is no jaw joint tenderness, and there are no clicks present. So will you please smile, frown, and puff out your cheeks? Perfect. So that means that cranial nerve 7 is intact. And will you please say "ah" for me? Perfect. And the oral mucosa is pink, moist, with no lesions present. Tonsils are present at a 1+ grade. The uvula rises on phonation, and the soft palate elevates in the midline, which means that cranial nerves 9 and 10 are intact. And will you please stick your tongue out for me? The tongue protrudes on the midline, which means that cranial nerve 12 is intact. I'm now going to palpate your carotid arteries. Perfect. They are 2+ out of 4, symmetric and equal bilaterally. I am now going to also take them with the bell. Perfect. There are no bruits present. Now I'm going to palpate the supraclavicular nodes. Do you have any tenderness?
No.
There is no tenderness on the supraclavicular nodes, and there is no enlargement. Now I'm going to whisper in each one of your ears, and please repeat after me what I say.
5. Blue.
Those are correct, which means that cranial nerve 8 is intact. And I see that the chest is symmetric and there's no use of accessory muscles. And now I'm going to also take the anterior and posterior chest. So just breathe in when you feel my stethoscope on your skin. I'm just going to lift up your shirt. Perfect. And if you will turn around for me with your back facing the camera. Perfect. I am now going to also take the posterior chest. Just breathe in, take a deep breath when you feel my stethoscope. Okay, face front for me. Lungs are clear to auscultation both posterior and anteriorly and bilaterally. And I'm now going to put the patient at a 30 to 45 degree angle. So I see that the skin color is appropriate for ethnicity with no signs of cyanosis, rubor, jaundice, or pallor, and hair is present and evenly distributed over the extremities. And I'm now going to check for jugular venous distension. Other side. Ooh, got my pen. Okay, sit up for me, please. So the jugular veins are flat bilaterally, which means that there is no jugular venous distension. And I'm now going to palpate the pulses, starting with brachial. Now radial. Now femoral, which is right here. Now popliteal. Now the dorsalis pedis. Now posterior tibial. Now I'm going to, all pulses are 2+ out of 4 and symmetric and equal bilaterally. I'm now going to sanitize my hands. Okay, and I'm now going to palpate the inguinal lymph nodes. Do you feel any tenderness?
No.
There is no tenderness and there is no enlargement of the nodes. And now I'm going to feel skin temperature with the dorsum of my hands. Okay. So skin temperature is warm and there is no moisture. I'm now going to assess skin turgor. So there is instant recoil, which is normal bilaterally. And I'm now going to check edema on the anterior shin, top of the foot, posterior ankle. Now the other side, shin, top of the foot, posterior ankle. There is 0 out of 4 edema, and now I'm going to check capillary refill. Okay, other foot. Okay, I'm now going to sanitize my hands. Okay, I'm going to check capillary refill on the fingers. Okay, capillary refill is less than 2 seconds, which is normal. And I am now going to listen to the heart sounds with my bell to detect low pitch sounds and my diaphragm to detect high pitch sounds. Okay, the first spot that we are going to is going to be the aortic, which is in the right second interspace. And now we will be going to the first pulmonic, which is on the left second interspace. And now we will be going to Erb's point, which is in the left third interspace on the sternal border. And now we will be going to the tricuspid, which is on the left lower sternal border. I'm going to lift up your shirt. And now we'll be going to the mitral, which is on the left fifth interspace on the midclavicular line. Now I'm going to be assessing with the bell. Lift up your shirt one more time. Okay, all heart sounds had even rhythm, were equal and symmetric bilaterally. And I'm now going to put the patient in a supine position with their knees bent or with a pillow under it. Perfect. Gonna lift up your shirt, pull down your pants a little bit. I am now going to be listening for bowel sounds in all 4 quadrants. Okay. Bowel sounds are present in all 4 quadrants, and I will now be listening for bruits. First is aortic. And second will be renal. And now iliac. There are no bruits present, and now I am going to percuss the abdomen. So there are sounds of tympany present and in all 4 quadrants, and I'm now going to lightly palpate the abdomen. First, I'm going to start with the right upper quadrant, which is the liver and the gallbladder. Okay, now I'm going to percuss the left upper quadrant, which is the stomach, spleen, and pancreas. Now I will be percussing the right lower quadrant, which is the appendix and the ascending colon. Now I will be percussing the left lower quadrant, which is the sigmoid colon. Do you feel any tenderness in any of those spots?
No.
Okay, there is no tenderness, no resistance, and no masses present. Okay, will you please sit up for me? Thank you. Okay, I see no swelling and no deformities on the neck, upper or lower extremities. And now I'm going to have you grip my fingers as tight as you can. Perfect. Hand strength is normal and equal bilaterally. So now I'm going to have you flex your elbows towards yourself. Perfect. Forearms flex at the elbows. And now I'm going to have you flex your elbows like this again. I'm going to have you pull towards yourself as hard as you can. Pull. Perfect. Now push against me. Perfect. Push and pull is normal and able to maintain strength against resistance. Now for the lower legs, will you please flex your legs at the knees? Perfect. And will you please push up against my hands? Push, push, push. Perfect. Now lift your legs, pull it downwards. Perfect. Push and pull is normal and able to maintain strength against resistance. Now will you please stand up for me and face this? Okay. There is no skin breakdown at the occiput, at the shoulders, at the scapula, the elbows, I'm gonna lift up your shirt. The sacrum, truncators, the ischial tuberosities, the lateral and medial knees. Will you lift up your foot, please? The lateral and medial malleolus, other foot. Okay, and on the heels, other foot. You can sit down. And that is going to conclude our head to toe assessment. Thank you.